Welcome back in, everyone. I'm Sarah Shahayev. In this morning's Health Alert, Colorectal Cancer Awareness Month is now underway. It's a disease you might recognize because several celebrities have unfortunately lost their lives battling it. Most notably, Chadwick Boseman, best known for his role as Marvel's Black Panther. Boseman died in August of last year after a 4-year battle with the disease. Most recently, actress Natalie Desselle died of that same cause in December. Even with these deaths, it's a type of cancer that is often overlooked and undiscussed. Well, here to help us bring awareness to this very important topic is Dr. Lawrence Melilara. Thank you so much for coming on the show today. You are a colorectal surgeon with Dignity Health, so this is really your expertise. Thank you so much again for providing your time to us.
Thank you for having me, Sarah. I appreciate the time. As you mentioned, colorectal cancer is a cancer that is not being talked about much, but it's a very common cancer. It's actually the third leading cause of cancer diagnosis in the United States and the second leading cause of cancer-related deaths in the United States. More people die from colon cancer than die from breast cancer or prostate cancer.
Well, those are really startling numbers. So I just have to ask, why do you think it is getting so overlooked when so many people are falling ill from it?
A lot of the issues have to do with screening. Colon cancer is actually a very preventable and treatable disease, especially when it's caught early. But the main issue that we have as physicians is getting enough people to get screened. This became acutely a problem, and we all became aware of it, especially last year when COVID kind of overwhelmed all our lives. With people missing out on a lot of their screening tests and colonoscopies to get diagnosed with this cancer. The point of March, and we do this every year, or at least we try to do this every year, is to raise awareness on this particular cancer that it's not usually talked about very much in communities. Sure. And we want to make sure that people understand that there's options out there, not just for screening, but also treatment options that we have available for this particular cancer.
All right, doctor, I just want to ask you, for folks that are listening right now, obviously those statistics, again, are very alarming. So what are some warning signs that people should be on the lookout for?
So unfortunately, colon cancer is what's known as a silent disease. There's very few warning symptoms, especially early on, and the symptoms are very mild. But things to be aware of and to pay attention to are things like abdominal cramping, pain, weight loss when you're not trying to lose weight, weakness, fatigue, blood with stool, change in the caliber of the stool. As you can see, is very non-specific type symptoms. Usually, what we recommend is that patient get screened for colorectal cancer when they reach a certain age, and if any of the symptoms persist.
And what is that age that you recommend?
So the current guidelines for screening for colorectal cancer are to start at 45 years old if you have no family history and no other risk factors.
Okay, that's
at
important.
45 years old, which is younger than used to be a few years back, which was 50 years old.
Yes, and we are seeing that again, as you just mentioned, that number being pushed back. And I asked that because actor Chadwick Boseman died at 43 and actress Natalie Desselle died at 53. So those are obviously, young ages. So currently those screenings, as you mentioned, are for those 45. Now we're learning and older. So what do you think people should do in terms of getting screened? Is there an age that might be too young to go, considering the people who have died from it?
Right. So there's no age that, you're too young for it. If you're having symptoms or if you have family history of colon cancer, or if you have certain medical problems, your risk of developing colon cancer is higher, which is why screening may need to be done even at a younger age. The mark of 45 years old has been made because of what you just mentioned. We are catching colorectal cancer in younger and younger patients, and we're also finding it to be much more advanced. As you mentioned earlier, the famous actor Boseman, he was 43 when he was diagnosed with colorectal cancer. He was stage 3 at the time. He fought it for many years, and he's not alone. There's quite a few patients, even here in Kern County, who get diagnosed with colorectal cancer every year at a younger age. We've actually seen a doubling of patients who are younger than 50 years old getting diagnosed with colorectal cancer in the United States every year.
That's obviously very concerning, and I know our community is taking this very seriously. And you'll actually be on a physician panel today to share more about the disease. So just very quickly before we let you go, tell our audience
That's
how
right.
they can watch it.
So today at 12 p.m., myself and several other physicians, local physicians here in town, will be discussing colorectal cancer awareness, but also screening methods, availability, treatment options, and answer questions as well. This is open, free to the public. Everyone can register at dignityhealth.org/Bakersfield/DocDoc.
All right, everyone. So you just heard the details right there. It's happening from 12 to 1 p.m. today. Dr. Lawrence Melalari, a colorectal surgeon with Dignity Health. Thank you so much for your expertise and shining light on this very important health topic for us. You have a great day.
Is there a story you think we should investigate? Call our Eyewitness News tip line at 869-2929.